Go.
Okay, so before I go into the room, I am just going to check the medical chart. I'm going to make sure that they have an NG tube that's ordered and why they have it ordered, and then I'm just going to make sure that I have all of my supplies. And so I do have everything I need, so I'm going to enter the patient's room now. I'm just going to knock on the door, bring my card in. I'm going to introduce myself. Hi, my name is Drew. I'm a student nurse. I'm going to be helping you today. I'm just gonna ask for 2 patient identifiers for their name and their date of birth, and I'm just gonna check it on their bracelet, and I'm gonna check that it matches on the computer. Everything matches. And then I'm going to explain what we're gonna be doing today. So we are gonna be putting an NG tube through your nose and into your stomach, and this is to suction things out of your stomach. It's gonna go suction into this canister. This may be a little bit uncomfortable, but we're gonna try and make the process the most comfortable that it can be, and I'll walk you through that as we do it. And so then I'm just going to sit them up in a right position, so either in high Fowler's or 45-degree angle. So I'm just gonna lift them up into this working position. Okay, now we're here, and I'm just going to wash my hands now that we're set up. And to say this, I would normally wash my hands right when I enter the room. I'm doing that now and just verbalizing that. So I got my hands washed, and I'm gonna put on my gloves. And then I am going to set everything up and get all the things out that I need. So I'm just gonna set this to the side. I'm gonna get this out. My tube. This is not a sterile thing that we're doing. We're just doing it to in a clean way. So I'm gonna need to get their cuff, marker, all this out, and then lube, marker. Should be good there. Okay, so now I'm gonna take this out. And I am going to measure this on their face. So I'm going to measure from the nose to the ear down to the xiphoid process, and here I would make a mark. Depending on like the facility, you may do it a little bit longer, but for now in this patient, I'm just gonna mark it right here. Okay. Now I would ask what the patient, which nostril they want to use and which they can breathe out of better, and they had mentioned that they want to do this right nostril. So I'm gonna lube this up like 2 to 4 inches. To make sure that it has enough lube on it and that it will go in. So I have a little cup in case, wait, first before I do that, I need to actually put this on them so that they can stay clean. Okay. And this cup I'm gonna give to them in case that they need to, if they have to throw up or anything like that. And first I'm just gonna ask them to tilt their head back. And so I'm gonna have them tilt their head back, and I'm gonna start putting this in. So I'm gonna start putting this in. Okay. And I'm gonna still have their head tilted back, and I'm gonna keep pressing this in until they gag in the pharynx. This is where they're gonna probably start to gag. And once that happens, then I'm gonna ask that they put their head forward and that they take some sips of their water as they do this and swallow, so that we can help this go down and it can feel more comfortable. If they were to gag, cough, anything like that, we can stop and wait, or if they stop breathing, you can notice anything, we can discontinue this and we can stop. But I can see that they're fine right now, so we're just gonna keep pressing this in, and we're gonna go all the way to the point of where I marked my tube. Okay, so right here, now I'm gonna take a piece of tape and I'm just gonna put this gently on here, because at this point we are just going to make sure that it's in the right spot. So, sorry, this is not staying, but we're just going to say this is staying right here. And as x-ray comes in, we're going to have them examine to see if it's in the right spot. As well, at the same time, I am going to see if I can pull from the stomach. And I'm going to pull from here the acid. Perfect. Okay. I'm going to put this into this cup right here. And we're going to be checking the pH that's from the stomach. And I'm going to wait 30 seconds. I'm sticking this in here, waiting 30 seconds to make this, or to wait to get the results from this. 30 seconds has passed. Now we're just going to look for the yellow and the red. It looks like this is the right pH, so we're set there. So now that we know that this is in the right spot, I'm just going to take this off. And we are gonna tape this on now. So I'm gonna pull 4 inches of tape and I'm gonna split this. I'm gonna rub my skin barrier on here to make sure that that this can help with the skin. Now I'm going to put this around here, and I'm going to put this around here. And I'm going to stick this right here. Now, I am also going to mark where we're at, how much we have left right here, so that we know that it stays in the right spot. And I'm going to take my pin, so I'm going to have them turn their head. So I'm going to have them turn their head to make sure that we're not pulling on this. We don't want to pull on it. We don't want to tug on it. And we just want to make sure that this stays in the right spot. So I'm just going to clip this through here. Put their head in the right position. And I'm just going to take this back and clean this up. I would throw this away in the garbage can and their cup as well. Now I'm just going to move this out of the way. Okay, now this part we are going to be suctioning. So we are going to be connecting through this to a low intermittent suction. And this is because it's not suctioning all the time. It's just, it stops, suction, stops, suction. So we're going to put this together. Let's see. Okay. We're gonna let that go, and we would turn this onto a low intermittent suction and put it in the right spot so that we know that it's suctioning out everything that we need to suction from the stomach. And we would answer any questions that they might have after that. Now I'm just going to take this, I'm going to clean their mouth off and their nose, anything that they need cleaned up right here. And then I'm going to apply chapstick, all of that. And then I'm going to take my gloves off and I'm going to wash my hands and make sure that I have everything cleaned up. I would ask them the position that they want to be sitting in. I'm just going to lower them a little bit because that's what they said that they want to be in. Make sure that their bed is low down. And I would, again, answer any questions, come back, make sure that everything's going well, and I would document everything that we did. And yeah.